So I want to focus this week on the concept of public health, which the authors just essentially describe as the area of medicine that deals with the protection and improvement of citizen health and hygiene through government agencies. And I think this is one of those fundamental areas. As long as we're on the topic of healthcare, it's one of the real fundamental areas to look at, because so much public policy and the relationship between the federal government and state governments flow out of what this concept means. And that's primarily because there's such a wide range of normative arguments and judgments as to how active state and federal governments should be on the area of public health. And many of these issues are really politically contentious, and you're never going to have consensus on many of these issues, and they tend to be very sensitive, particularly with public health or health issues where maybe government could be seen as inappropriately intruding on the personal choices of individuals. And the authors spoke to, I thought, an interesting range of different areas related to public health. And they speak to, for instance, tobacco. How is that a public health issue that state and federal governments have a right to impose themselves, in the personal choices of individuals who may choose to use tobacco. They also speak to, and that could be something that's contentious, but there seems to be agreement in terms of the level of regulation that tobacco is under. And so that is, I think, kind of been determined to be an area of public health that there is consensus on. Another area where there seems to be a good amount of consensus on would be, the extent to which federal government and state governments assist in the control of contagious diseases, particularly in a globalized society where diseases tend to spread quickly, and you really need the resources and capability of a centralized government or well-resourced entities to be able to help the public health. And but they also speak to some other policy areas that can be very politically contentious, and the author spoke about obesity, how that really is a public health issue, but there's disagreement and a lot of contentious debate about the extent to which government should be involving itself in the personal choices of individuals. The author spoke to like the soda tax and other things like that, to where there could be tension between the state and federal governments and local governments to that extent. Another really contentious issue that they spoke to was the issue of guns, and how whether that can be seen as a public health issue that state and federal governments may regulate. And there could be some tension there as well, because there could be completely different normative ideas as to what the appropriate response should be at the state level and the federal level. And those are the kinds of things that I think flow outward into wider healthcare policies. And I'm thinking of like Medicaid and the Affordable Care Act, and these are for instance, with Medicaid, the authors speak about how it's theoretically a joint state-federal program, but it tends to go in the direction of what the federal level wants, and they actually even they use the word whipping state governments, and so I think we can look at these policy areas, Medicaid and Affordable Care Act, and see how tensions can arise between the state and federal levels. And also, I think, getting back to what I just said about the federal government sort of leading or having the control or the upper hand, the authors speak to how they really do this through, I don't want to say manipulation, but the dangling of federal dollars in order to compel a desired action. And when we're talking about healthcare, it's a particularly important consideration because healthcare is incredibly expensive, and the authors speak to how 24% of the state's general fund revenues go to funding just healthcare. So it's really an area that the states, to a large extent, they could not afford to go against the federal government. So that sets up a power dynamic that really gives the federal government the upper hand if they decide to pursue a policy direction, and that's particularly true in the area of healthcare, where the budgets and the costs are astronomical, and that really sets the stage for a lot of potential tension between state governments and the federal governments as they determine what they're going to do on a policy level. And I thought those were some of the interesting points this week when it comes to healthcare.